Howdy, folks. We're going to take a look at Chapter 14 on early childhood education. Our next two chapters are not specific disability categories, they're more conceptual chapters, although early childhood education is a very large part of special education, so large and important. In fact, it has its own part of IDEA, and it has some of its own special, unique characteristics that differentiate it from the, I guess you could call it the standard special education process, or like the standard, and the standard IEP as well. But we'll get into that in a second. So what is early intervention? They call it early intervention, early childhood education. So the big difference between the early childhood special education and regular special education is the incorporation of out-of-school time and incorporating the family, so much so that the actual name for the IEP in early childhood education is actually called the IFSP, Individualized Family Service Program. Okay, IFSP, Individualized Family Service Program. That's going to include a lot of things beyond just educational things, as well as functional things and certain supports and community outlets and resources that the school base and the early education cooperative basically works with the family to get the kids ready to go to school and be successful in school. Does it work? Yeah, it works. I mean, the idea of early intervention, I mean, even medically, is pretty much always useful, right? Early cancer screening means higher survival rates. Early intervention means we have more time to fix something before it becomes unfixable. Not saying that a child's learning could be unfixable, but I mean, medically or health-wise, that's kind of the idea of early intervention, right? We fix it, we catch it early, we work on it, we rehabilitate, and we have the best chance for a successful outcome. That model is very much true in education as well. If we start at 2, we're going to give a student basically 3, more years before entering the K-12 system than a student who just comes into kindergarten on day 1. We don't know anything about them, and we find out they have a disability. A student who had been identified early and who went through early childhood, maybe first steps and things like that, has had, basically thousands of hours more specialized and targeted, treatment and therapy and other sorts of services given to them. So it's easy to say that that child is going to be very far ahead of the child who just comes in day 1 to kindergarten, and we don't find out until, maybe till the end of kindergarten, maybe later, until that they have a disability. So this is actually one of the big things that they did. I remember when we had our speaker, he talked about IDEIA. That's the Individuals with Disabilities Education Improvement Act. That was I'm pretty happy with you guys knowing IDEA because that's the basic. But this is basically the reauthorization of IDEA in 2004. And they did do a lot to make sure to emphasize early childhood education going forward, and they certainly have. But aside from just creating educational outlets, we also wanted to incorporate the family and other community partners because, okay, in the K-12 system, right, so we give services at school and then we go home, and then what happens? We kind of assume that the parents are, maybe trying to help or assist as they can. And maybe this is a shortfall of the IEP process, but the IEP process really only has to deal with between 8 and 3, Monday through Friday. The early childhood and IFSP process is a 24 hours a day, 7 days a week thing. And the attitude, which I certainly agree with, is why are we limiting intervention time to just those 6 hours a day when they could be receiving intervention time 16 to 18 hours a day? And no, it might sound unreasonable, but when you have the buy-in of the parents and when you've trained parents, when you've given them resources, and you've given them skills and strategies that they can specifically work on. Remember that not everything has to be an academic skill. It can be a functional skill or a life skill. So, we could be teaching some sort of skill while we're feeding, while we're toileting, while we're getting dressed, while they're playing with blocks, while they're walking, or while they're, trying to crawl around, or, any of the things that little kids do. You could pretty much tie either some sort of functional life skill or some sort of academic skill with that, and you can work, in a prescriptive manner at home to provide better services than if you only would have gotten services at school, or in the case of early childhood, at like a First Steps or a Head Start type of a thing. So basically, we've gone pretty far from the original iteration of IDEA. We had the one edition brought the idea of special education to preschool, and then IDEA furthermore added in Part C, which actually brought protections for students with disabilities, or at least students who are considered at risk, starting at birth, and that's pretty important. So one thing that I would like to talk about is this idea of labeling in early childhood. We do not need a disability label for a child to receive early childhood special education services. As a matter of fact, many times we kind of go against the idea of putting a label to it too early. We talked about labeling very early on in the class, and the idea that labeling comes with the social stigmas and other sorts of self-identity, and other sort of negative implications and ramifications. Now, combine that with the idea that children learn and develop at a different rate. That's in task number 1. I'm talking about the INTAS standards. We understand how children learn and develop, and that they learn uniquely and differently across the different planes. For many students, we may see a particular delay in some area, in speech, vocabulary development, motor skills, or any of the other specific skill areas for little kids. A lot of little kids grow out of their little deficit areas. They just hit their spurt later, or one thing or another, and a lot of kids come out of, maybe they need a little bit of help to kind of get a leg up or a boost, and they get some help for a little while, and then they return and they don't no longer have a need for getting the help. They return to grade level or age level performance. Problem solved. Those students don't need a disability categorization because we have basically remedied the deficit area. And the student didn't have a specific disability. Or if they did, maybe it was remedied and we no longer have the need for special education services. If we go back to pretty much every single disability category, one of the eligibility things was a demonstrated need for special ed services. That's pretty much in every single definition. If we take care of a deficit area, is there a need? No, there isn't. That doesn't mean that we couldn't possibly keep an eye on people, but using RTI with universal screening and all of the other data factors and data farming that goes on, we can find out if a student starts slipping up again, because we have all that data that we have coming in pretty constantly. So the IFSP, Individualized Family Service Plan, it's basically the IEP for students who are working with early childhood services. Like I said in the introduction, we call it the Family Service Plan because of this idea that we shouldn't take a vacation from providing early intervention just because it's not between 8 and 3 and Monday through Friday. Intervention should not be just at the school. Intervention should be happening in the home. The home is the most naturalistic environment for a child. It's also the environment where a child is most comfortable and most familiar. If we can provide interventions in the home, we don't have to have, we don't have to worry about the assimilation into a new environment. We don't have to worry about establishing new routines or any sort of anxiety from being in some sort of foreign place, or something that's unfamiliar or with unfamiliar people. You're working in the home with the family, and yes, you will have professionals, and yes, there are out of home places you can get help, and yes, there are professionals that'll be working with the family. But the idea of interventions shouldn't stop when you leave First Steps, or when you leave Head Start, or when you leave special ed preschool or something like that. Because you can get 2-3 times the amount of overall intervention minutes if you're doing that sort of thing at home. So we already talked about the idea we don't necessarily have to be identified as having a specific disability to receive special education services. That's the idea of at risk, okay, or sometimes called delayed, but I think at risk is kind of the popular term, at least of current time of recording. So the IFSP is going to basically have some of the same components of the IEP. The top point being basically your PLAF, which is your present levels of functioning. You also have an understanding of what the parents are. Okay, so basically the background, what sort of resources and understanding, what do the parents want to work on, what do parents have issues with, what can the parents assist with, what sort of resource barriers are there to receiving access. And then you're going to have the goals and the progress monitoring and things like that, and other sorts of recommendations for what specifically to do, provided that it's based on actual data and research. Where is it going to take place? So that's the overall environment. That'd be in the home. It could be in a center. It could be like that. We have start-stop dates. That's the same as the IEP. And then your service coordinator is basically going to be the person that's going to be delivering. That's like your teacher of service, as it were. The person that's going to be actually delivering the services or the instructions. And then the idea of support for transition, which would basically be how do we transition a student from early childhood programs to either preschool or kindergarten, or whatever the first level of school is that they are trying to enter into. So, okay, we've already pretty much talked about the differences between IFSP and IEP. The IFSP is more of a family-based thing. It has to do with out-of-school things in the natural environment, whereas IEPs are basically in-school prescriptive things that happen from the start of the day to the end of the day, including the transportation to and from. As far as how do we identify kiddos, we have a few different ways of doing so. We have certain types of testing, and testing is pretty broad terminology. We have medical testing, so we can do both blood and genetic types of testing to identify for maybe like a genetic disability, like a cognitive disability or something like that. You can also see if there's some sort of chronic, or some sort of health issue that could potentially be some sort of problematic in the learning environment. But we also have scales and certain other types of rubrics or survey style assessment where, what can or cannot a child do, certain kinds of skill sets that they either can and cannot do, based on what other children of that age can or cannot do. And if you see enough of a pattern, then that's a considerable amount of evidence. So as far as our assessment areas, motor development, that's both fine and gross motor. That'd be not only just walking, or at the very basic, gross motor skill is basically skeletal stability, the ability to stand and balance. Walking is kind of a more advanced form of that. And then you get into more fine motor skills such as grasping, actually using specific digits, fingers, to be able to perform specific tasks like gripping specific instruments, pencils, spoons, forks, make a fist, being able to clutch a ball. Those are all different forms of fine and gross motor movement, as well as things like focus, and other things. Cognitive development, so that would be, more or less intelligence screening, social and emotional development, that we have as a child interact with other sorts of stimuli, environmental stimuli, and then adaptive behavior, which is that kind of that subtext, that more nuanced, unwritten rules style of skills that we all kind of learn by observing. So that can be a awareness, that can be an awareness type of a thing. And we talked about goals and progress. And we talked about progress monitoring in the actual parts of the IFSP. And then this idea of systematic observation, that would be actually collecting data. And also the idea of play is an excellent way for especially pre-verbal, little kids to be able to demonstrate skills. How do we interact with, specific, age level toys or other sorts of, recreational things that other age peers, may interact with. Is there a fixation? Is there a proper interaction? How can we compare this child's interaction with age appropriate things with other age peers' interactions with the same things? So as far as what are our goals? Well, our number one goal is we're trying to support not only just the child but the actual family, provide them as much resources and tools as we can. We want to create as independent of a child as we possibly can, because we want all children to be able to, ultimately be as included and mainstreamed in general education as possible, and that comes with some certain prerequisite needs for a particular level of independence. Development in all domains, and that's not necessarily just verbal or motor, or it's all the specific areas that we were actually looking when we were trying to make a decision on identification, including social skills and things like that. And we're trying to get students ready to go to school, and by doing so, teaching them the types of academic or learning skills that are going to make them successful in school. Okay, so we talked about the idea of doing things outside of the home and family. So developmentally appropriate practice. This is the idea that we need to understand where a student is and where a student needs to be. So age appropriate practice and developmentally appropriate practice is actually would be two separate things. So a person who's 2 who may have let's say like gross motor functioning of someone who is 12 months, maybe they're just like they're not really don't have good balance or something like that, and we need to work on those specific balance types of skills. We wouldn't necessarily be working on 2-year-old skills. We'd be working on skills for children where they're specifically at developmentally. That's kind of the whole idea there. Okay, so we've talked about goals already, but basically when we're making goals, we want to make sure that they're functional goals, that they're usable in multiple arrays. The skills that we're teaching are generalizable or usable, and there is making sure that they're observable and measurable, and making sure that we have some sort of we make sure that we are paying attention to specific academic goals as well. So we talked about the idea of play-initiated, or play in general as a good form, first of all, of play. It's a good way to first of all assess students on how they interact with kind of like age appropriate stimulus or toys or things in the environment, but at the same way it's a good way to see early creativity, to maybe present some sort of problem and to allow them to be able to kinesthetically move things around and try to and just see how their brains, how they critically think, how they problem solve, and to what extent do they basically learn or solve by doing. And then this idea of peer inclusion, the idea that we want to teach social skills, and we teach social skills by basically including students with other age students, because that's really the only way you learn, is by being around said students. So service delivery options, where is this going to actually happen? Across a bunch of different places. So first of all, you can have them in the home. Okay, that's a pretty common place to have them. They come to your house, they do specific work. But in some instances, we may do work in a hospital, especially for students with more chronic or health-related sorts of things. We also have specific early childhood centers, and we have First Steps, Head Start, things like that. But basically, we're providing services well outside of the general idea of the school, where we're used to thinking that kids, who have disabilities with IEPs get help. So, just to review, this idea of the family, right? This is pretty much the theme of the entire of chapter 14, is that we are trying to empower the family. We're trying to give them as much support and as much resources as they can to help the specific child who may have some sort of either learning delay or some sort of need for early childhood special education. We realize that they are going to be able to provide more hours of direct instruction, and we realize that they've developed enough of a relationship and have enough working, even just observational knowledge about their child, that we can work with them, so we can work together to provide the most, going back to earlier slides, the most independent, the most gainful, and the future with the most opportunities for the child. Okay, so just to back things up for chapter 14, your main ideas is this idea of the IFSP. Understand that we have made some changes to IDEA to help students first in preschool and then back to from birth to age 3, and we kind of worked backwards to do that sort of thing. Understand that IFSP is a family-centered thing. It takes place not necessarily in a specific school or even in a facility, but oftentimes takes place in the actual home. The idea is to do things well beyond just academic types of skills, but we may be providing things like gross motor and fine motor, social skills, emotional and behavioral supports, communication supports, as well as providing the parents those same types of supports, and as well as helping them to be able to regulate, monitor, and help, either reinforce wanted skills or to try and extinguish unwanted behaviors or things like that. Everything we always should have an academic or a cognitive component to the IFSP, because we're trying to develop all areas of the child, not just one specific area. Talked about developmentally appropriate does not necessarily mean age appropriate. You may be giving things to students that are well below their actual age level. That's perfectly okay as well. And then lastly, the idea that the parents are going to be our number one resources in helping students with early childhood needs. No one's going to know their child better. Nobody's going to have more information about their child. Nobody's going to have more anecdotal observation, amount of hours observing a child. So they are our number one resource, and they may be the number one person, they're probably going to be the number one person actually providing those supports, especially out of the time from when the actual first steps or the Head Start person is actually there working with the child. The parent will probably be working with them for many, many more hours compared to the time that they are being worked with from outside people. So definitely it's going to be a team game, and the parents are basically the captain of the team because it's their child. Okay, so that was our quick version of Chapter 14. Thanks for watching, and stick around for Chapter 15.